We want to take this opportunity to thank the members of the Kenya National Union of Nurses and Midwives Union for engaging the ministry to agree on a collective bargaining agreement. Indeed, this journey has been long. It has taken long in terms of our discussion and arguments. And we want to thank the union for being honest in our deliberations, in our discussions. And we have come to an agreement that brings us together in form of the collective bargaining agreement. I want to assure the union that as agreed in this collective bargaining agreement, we shall endeavor to deliver on our part as a government. Our request therefore is to the union to urge their members to continue dedicating themselves to delivery of service at this very critical juncture where we are implementing universal healthcare coverage. We want to call upon all the health workers to collaborate and work closely with the government. We've seen the effects of protracted, long negotiations on issues that should take us a short time to agree. All that we ask the union members is to comply with the provisions of the law, and upon compliance to that, we quickly sign the collective bargaining agreement because we know a part of the union and what they are supposed to do, and a part of the employer, who is the Ministry of Health, for now. We expect that we shall honor this agreement and ensure that we fulfill it. When the time comes for renegotiation of the collective bargaining agreement again, we need not to fight, we need not to go on strike. We start early so that we iron out the issues, because these issues are ever changing, and the welfare of the union members needs to be taken care of by the employer. As employers, we want to affirm and we are ready that we shall comply with all that we have agreed in this collective bargaining agreement. Thank you.
So thank you very much. And first and foremost is to note that the nursing community that we have in the medical field, and we so feel that signing this collective agreement is the very best way forward to ensure that we continue supporting them, ensure that we are aligned to the changing world from today. And I want to thank the nurses very much that this is the union that has not gone even on industrial strike in a very, very long time, because we have been in conversation and we have agreed on a number of issues, and they have been patient, and you can see patience pays. Secondly, this is the first ever collective bargaining agreement with the Ministry of Health, and we are happy to achieve it together and again implement the same together. So I want to ask my dear brother Panyako that the same patience that has seen him go through this and agree with us is the same kind of issue that we would want to continue working together. We want a collaboration in terms of human resources for health, and human resources for health being one of the key pillars for universal health coverage. Let us go together, let us help people at the bottom of the pyramid, let us help Kenyans at all levels of economy and equally in all our health facilities. Thank you so much.
Thank you. I want to take this opportunity to first thank the Ministry of Health under the stewardship of Madam PS and all other ministry officials. It is true that the nurses have waited for this CBA for more than 10 years. We have agreed more than 4 times and it's changed. We agree it's changed. But at long last, we have a collective bargaining agreement that will serve as a foundation for the future engagement. As a nurses union, we have resolved to engage our employers both in public and private sector through the law, and specifically putting forward the issue of dialogue. We do not want to engage in industrial actions, because most of industrial actions, the end result is loss of human life. And when we lose a human life, you cannot repair it, you cannot bring it back. It's not like a car that you can take to a garage, fix and put a new tire. So industrial actions for us as a union will be the very last resort, maybe when the employer has completely refused to engage us. But moving forward, we want to only engage with the employer, the ministry, and other employers who are not in the ministry. We thank the ministry for midwifery this CBA that is the first for the nurses union with the Ministry of Health. Thank you very much. We don't have much to say.
Probably will tell the media what are some of the fruits that you're harvesting from this CBA.
The CBA, basically we normally discuss one that has been registered. So it's premature for us to start discussing before its registration. But I know we have made some grounds which are going to be a foundation to achieve what we have. But one of the key issues is that the government made a promise with us in 2017 of enhancing our uniform allowance, collective bargaining agreement, uniform allowance, and nursing service allowance and risk allowance. In this CBA, we have gotten our risk allowance, we have gotten our uniform allowance enhanced by 5,000 shillings. We expect it to go up to 25,000 in subsequent CBAs, and also the nursing service allowance to go to 30,000 in subsequent CBAs. I thank Moi Teaching and Referral Hospital, the only public institution within the health sector that has fully implemented the return to work formula of 2017. And that is the place I wish to work if I became a young nurse. Thank you very much.
Asante. You can unpack it later.
All right.